Hello and welcome to Nurse Expertise. I'm here with Hassan and today we are delving into the intricate procedure of cardiac catheterization. Whether you are a medical professional, a student or just someone looking to understand more about heart health, this video is your guide to the hows and whys of this life-saving procedure. So let's get to the heart of the matter. Hassan, could you explain what cardiac catheterization is and what it entails?
Imagine a camera journeying through the veins right up to your heart, capturing data and images. That's cardiac catheterization for you. A medical procedure performed to diagnose and tackle heart problems such as coronary artery supply, electrical functioning, placing pacemakers or defibrillator, or even measuring chambers of the heart, pressure and oxygen levels, or even determining the amount of blood pumped by the heart or finding heart defects that have been present since birth, and help diagnose heart valve problems.
Fascinating. Could you take us through the process of cardiac catheterization?
It's performed in an operating room equipped with advanced X-ray machines. While you're comfortably sedated yet awake, the doctor numbs a site, usually in the groin, wrist, or neck, and uses a needle to introduce a plastic tube called sheath into your blood vessel. Through this, the doctor inserts a long, thin tube named catheter towards the heart with real-time X-ray vision or fluoroscopy for guidance. The catheter can be used to measure pressure, take blood samples, or perform a coronary angiogram by injecting dye to allow the doctor to examine the arteries of the heart. After the procedure is completed, the catheter and sheath are removed. Pressure is held at the site of the puncture to prevent bleeding, or a specialized device is used to close the hole in the artery area and to aid in healing.
What about coronary angiography? How does that fit into cardiac catheterization?
This process uses contrast dye to unveil any blockage starving your heart's arteries. And if there happens to be a significant blockade, a tiny balloon can be inflated to open up the artery, followed by the placement of a stent, a kind of metallic scaffolding, to make sure it stays open.
Who typically requires cardiac catheterization?
Typically, those experiencing the terror of heart attack, chest pain resisting medication, or anyone with unsettling results from a stress test. Stay tuned for future video where we'll dive deep into the specifics of coronary angiography, and the other common cardiac catheterization is EPS, which will be discussed later.
Are there any risks associated with cardiac catheterization?
Every medical procedure comes with risks, but cardiac catheterization's track record speaks volumes about its safety. Common issues might include some bruising or a tender spot where you were punctured. However, though rare, more dire risks exist, like bleeding or blood vessel injury or reactions to the dye, kidney injury, and even stroke or heart attack or even death.
Are there any specific interventions associated with cardiac catheterization?
Well, yes, percutaneous coronary interventions or PCIs are invasive interventional procedures to treat CAD, include PTCA and intracoronary stent implantation. These procedures are classified as percutaneous coronary interventions as they are performed through a skin puncture rather than a surgical incision.
What is PTCA and who needs this procedure?
Well, PTCA is a specific PCI where a balloon catheter becomes the hero by pushing aside the blockage in coronary vessels and resolve ischemia. Now you may ask, when might a patient need this procedure? Well, PTCA is indicated for patients with angina and as an intervention for ACS. Catheter-based interventions can also be used to open blocked CABGs. Well, the purpose of PTCA is to improve blood flow within a coronary artery by compressing the atheroma. The procedure is attempted when the interventional cardiologist believes that PTCA can improve blood flow to the myocardium.
Could you tell us about the procedure for PTCA?
Sure. So PTCA is carried out in the cardiac catheterization laboratory. Just as CAG, hollow catheters called sheath are inserted usually in the femoral artery and sometimes the radial artery, providing a conduit for other catheters. Catheters are then treated through the femoral artery up through the aorta and into the coronary arteries. Meanwhile, angiography is performed using injected radiopaque contrast agents, commonly called dye, to identify the location and extent of the blockage. A balloon-tipped dilation catheter is passed through the sheath and positioned over the lesion, and the physician determines the catheter position by examining markers on the balloon that can be seen with fluoroscopy. When the catheter is properly positioned, the balloon is inflated with high pressure for several seconds and then deflated. The pressure compresses and often cracks the atheroma. The media and adventitia of the coronary artery are also stretched.
What happens next in the procedure?
We might need to use different balloon size to achieve our goal, usually defined as an improvement in blood flow and reducing stenosis to less than 30%. Intracoronary stents are usually positioned in the enthema of the vessel to maintain patency of the artery after the balloon is withdrawn. During this process, because the blood supply to the coronary artery decreases while the balloon is inflated, the patient may complain of chest pain and the ECG may display ST segment changes.
Interesting. What about intracoronary stents?
Right, so after PTCA, the area that has been treated may close up partially or completely, a process called restenosis. The intima of the coronary artery has been injured and responds by initiating an acute inflammatory process. This process may include release of mediators that leads to vasoconstriction, clotting, and scar tissue formation. A coronary artery stent may be placed to overcome these risks. A stent is a metal mesh that provides structural support to a vessel at risk of acute closure. The stent is initially positioned over the angioplasty balloon. When the balloon is inflated, the mesh expands and presses against the vessel wall, holding the artery open. The balloon is withdrawn, but the stent is left permanently in the place within the artery. Eventually, endothelium covers the stent and it is incorporated into the vessel wall. The original stents do not contain medications and are known as bare metal stents. I have to say two things about coronary artery stent. First one, some stents are coated with medications which may minimize the formation of thrombi or scar tissue within the coronary artery lesion. These drug-eluting stents have increased the success of PCI. And the second point is because of the risk of thrombus formation within the stent, the patient receives antiplatelet medications, usually aspirin and clopidogrel. Aspirin should be continued indefinitely and clopidogrel is continued for 1 year following stent placement.
Are there any complications associated with the procedure?
Complications that can occur during a PCI procedure include coronary artery dissection, perforation, abrupt closure, or vasospasm. Additional complications include acute MI, serious dysrhythmias, and cardiac arrest. Some of these complications may require emergency surgical treatment. Complications after the procedure may include abrupt closure of the coronary artery and a variety of vascular complications, such as bleeding at the insertion site, retroperitoneal bleeding, hematoma, and arterial occlusion. In addition, there is a risk of acute kidney injury from the contrast agent used during this procedure. Other complications are pseudoaneurysm and arteriovenous fistula formation.
Thank you for sharing this valuable information with us.
You're welcome.
That's it for today's video. If you want to learn more about CAG, just hang tight. It's coming up next. Don't forget to like, share, and subscribe to our channel. Stay healthy, stay informed.